Welcome to the Central Conversations podcast. It's a podcast where we interview interesting people, and today we're going to be talking about nursing in the trenches. It's an interview with Joyce Sayers, who's a registered nurse here in Loudoun County. Welcome to the Central Conversations podcast. I'm excited to welcome Joyce Sayers to the podcast today. Joyce is a nurse here at Fort Loudoun Hospital here in Lenoir City. Joyce is one of the most compassionate people you'll ever meet. She has a heart to serve and to make her community the best kind of community possible. And she's also a part of our health team at Central as we look at COVID cases here and try to decide what's best for our church to keep people safe and to make good health decisions. And I'm proud to call her a friend. So welcome, Joyce, to the podcast.
Thank you, Scott. It's great to be here and hopefully shed some light on information that questions that people may have.
Yeah, so tell everybody a little bit more about yourself and your background.
Okay, so I graduated nursing school in 1987. So that's 34 years ago, which the time's gone by all too quickly. But I've worked I actually started out as a certified nursing assistant working in a nursing home at age 15. And I think I was back then making $3.15 an hour. So where that all has come from. But I've worked in acute care hospitals. I've done float pool, I've done cardiac, I've done oncology, done kind of the gamut of things, done long-term care. And so now after we moved from Wisconsin in 2004, in 2007, I started working at Fort Loudoun Hospital here in Lenoir City, and I've currently been there for 14 years. I work in the surgery department, and I do a multitude of things there. I do pre-op, I do recovery room. We have a GI lab that I work in. I also work back in the operating room sometimes. So because we're a small community hospital, we all kind of have to multitask. So I enjoy getting to do different things in our department.
Yeah. So I'm curious, so why did you get into the nursing field? Why was that appealing to you?
It's kind of interesting when I was 15, the kids that I hung out with were working in the banks and the grocery stores and just kind of the regular teenage jobs. And I had a friend who said, why don't you come in and try this out, something different, and working in a nursing home. I'm like, well, okay. So I mean, it was like my first and only job in high school, and I just connected with it and I loved it. And I just said, this is something I think I really want to do. I enjoy interacting with people and just caring for people, and that just kind of carried on. And then after I graduated high school, I said, "Yep, I'm just going to go on to nursing school."
Hmm. Well, I know a couple years ago I had a procedure at the hospital, and it made me feel comfortable to see your face, and it kind of relieved some of my own anxiety since um,
Oh, good.
I'm not a huge hospital fan. In other words, I just don't prefer not to be there, and so you helped me work through that.
I think you're in the majority. I think there are not a lot of people that enjoy being at the hospital. And one of the things I do have to say about our hospitals, we are a community-based hospital. We do see a lot of patients from year to year that come back for procedures, that are in our community. And I think that's the beautiful thing about our hospital is that we are a community-based hospital, and people say, I wouldn't go anywhere else because they know us, they're familiar with us. They know we'll pray with them before their surgery if they feel that need. And we really try and make our care really personalized to our patients.
Mm. Well, I think it shows. So, everything changed, in March 2020. What was it like to be a nurse and to be in the hospital when COVID first began?
So I would have to say that collectively, just as our department and people that I have talked to in the emergency room and on med surge and whatnot. So you hear about this disease, and it's in China, and it's kind of morphing over to Europe, and like yeah, it's kind of like SARS and MERS, which are upper severe respiratory ailments. And I think collectively we thought, they'll get it under control before it really hits us. And then we started to see a couple cases in the United States. And then Louisiana got hit really hard. And I remember that because our son was living down there at the time. And I thought, oh my gosh, Mardi Gras. And that's kind of where it all started. And it just kind of took on a life of its own after that. So, we've, or at least for myself, when I first started nursing, the big disease of that time was AIDS and HIV, and we thought, oh my gosh, how are we going to overcome this? And from working, we've had, I mean, that's what medicine is, a big portion of infectious disease. We've seen mad cow disease, we've seen Ebola and Zika virus and hepatitis and staph infection. So you see the whole gamut of infectious disease. So when COVID started coming, we're like, yeah, we'll get this under control, no problem. And so here we are 18 months later, still dealing with this. So.
I'm curious, how has that kind of evolved over time? Because there's obviously been the waves that have come up and down, and kind of the emotional and the physical toll and shifts. And I know it's a little different being in a smaller rural than say you're in a New York City or like that. What's it been like for the staff and some of those challenges?
It has been challenging, and on Friday, it really kind of hit home to me. I had an interaction with one of our doctors, and I needed to talk to her, and I had to pass off some information to her. And as I'm talking to her, she's just looking so defeated and despondent, and she said, I'll do the best I can with what I've got, and she just wasn't herself. She wasn't her normal perky self. They're overloaded. As soon as they're discharging one, they're getting another one in. And not that our patients are critical as far as being on ventilators and everything that you've seen about COVID, but they're sick, and there's a protocol. And so you're not only trying to deal with your COVID patients, but you're trying to deal with your patients who don't have COVID and have other critical illnesses. And then you're dealing with your patients who are coming in sicker because they're putting off coming to the emergency room because they've heard there's so many COVID patients. So I think just around the board, people are in the hospitals are starting to just really kind of feel the stress of the whole last 18 months.
Yeah, and I felt this too, even as a pastor, kind of disappointment, right? You feel like, man, we're gonna the other side of this, and we
Right.
feel like we're able to get some headwind and have a normal fall, and it's like, oh goodness, here's another wave.
Right.
So maybe
Right.
that kind of hits.
The good news with that is that the patients that are coming in, while they're not probably as sick as patients were with COVID, the whole range is different, but we're seeing, I think the morbidity rate is down, which is good. As far as the number of deaths that we're seeing from the Delta variant. So that's good news. That's positive. And I think the vaccines are playing a big part of that.
Yeah. I'm curious, what are some things that have been helpful for you over the past, year and a half or so to kind of keep your attitude and your spirits up, to keep yourself encouraged? And maybe you and maybe some other of your coworkers.
So a couple of things. We've gotten cards and letters from people out in the community. I think it was just this past April, we had, I don't know if anybody follows the hospital on Facebook or whatnot, but the community got together and had this big thank you parade. And so the cars drove by, and there were people from different uh, businesses and community events that came by in their cars and thanked us. That was really a nice touch. We've also had different food trucks that have come by, and they offer different food. Different churches have put together little treat packs for employees at the hospital. So there's been some different things that the community's been doing. I think one of the most important things is that when patients come in for outpatient services, whether it be lab, radiology, outpatient surgery, or whatnot, they've been very patient, very kind, very encouraging, and thanking us for everything that we're doing. So I think everybody's been really understanding, and that's helped us out tremendously.
Okay, that's good. That's good.
Mhm.
We're recording this here in mid-August of 2021. What are you seeing in the hospital now, and what are you seeing in the larger kind of Knoxville area?
So our hospital has kind of been a little bit of a revolving door. We've seen COVID patients in. Probably 90% of them are unvaccinated, but it's nonetheless, you discharge one or two and you get one or two more in. I don't work that specific unit, so I don't know what the critical levels have been. I don't believe we've had a lot of what I would consider critical patients, but I do know that in other area hospitals, they have had more ICU beds filled up, and they have had some critical patients on ventilators and that kind of thing. So um, I think we're seeing an uptick. I'm hopeful that with the vaccine and with the amount of people that are potentially getting the Delta variant, that they're not getting as sick. The people that have been vaccinated. So that's a positive thought. And I think we're just going to have to roll with it and see what the outcome is. Hopefully we'll see an uptick, which we're at now, and with any luck at all, we'll see a downward influence as well.
Yeah. Well, I know for myself, and I know this. I was vaccinated a while back, and it took me then when the CDC gave those guidelines that if you're vaccinated, you don't need to wear a mask. So it took me a little while to kind of get used to that again, and then really been operating just still pretty cautiously, but also in a sense of freedom. And then, I guess a couple of weeks ago, being surprised by the fact that I got it, and I had no idea how that happened. And so, but I am grateful that I was vaccinated. At least that was more like a bad cold for me. And from what I've heard anecdotally from other people, at least who are vaccinated and had that Delta variant, it's tending to not last as long. But I'm still gaining energy slowly, and you don't know what the long-term cases or effects, I should say, of your body. So,
Right.
yeah. So, you talked about vaccines. Vaccinations are a hot topic today. I know in our county, we have about half of our folks in Loudoun County who are vaccinated. Some see vaccines as really an answer to prayer that happens so quickly. Others are hesitant to get vaccinated. We know it's a very personal decision putting things into your body, but it's also a societal decision. Can you kind of share from your own experience and background of your thoughts on vaccinations?
So I think you hit the nail on the head as far as it being a very personal decision. Um, I think the hardest thing for people right now that they're grappling with is there's so much information out there, and how do you decide what is fact, what is fiction? Um, because we are in such a heated political time right now, and I think that people, their heads are spinning. Do I take it? Do I not? What's it going to do to me? What are the long-term effects? Younger women are hearing, well, it could cause infertility, and older people are saying, well, is this going to affect my cognitive abilities? And so I think there's just a whole gamut of information. So I think what I would say to people, from myself personally, is do your research and make best the best decision you can for yourself. Use common sense, and just look at it and say, if I get sick, will this happen? If I take the vaccine, will this happen? It's just there's just a wide range of thoughts out there, and I wish I could say yes, take the vaccine, no, don't take the vaccine. Um, but there's just so much information out there. I would just say, talk to your healthcare provider, determine your health level, your risks, all that kind of information together, and just make an educated decision on it.
Yeah, and I've talked to a number of people who wish they could get it, but can't because of their health currently.
Mm-hmm. Mm-hmm.
One of the things that I've been, more and more aware of is kind of the tribalism in our country, and how there's different groups of people. And I've talked to people who are can't understand why anybody would not get vaccinated. And then I've also talked to other people who can't understand why anybody would get vaccinated.
Right.
And one of the things that I found really challenging is communication on both sides of that issue of like um, just the willingness to kind of understand somebody else's different viewpoint, which is different than yours. You know what I mean?
Right.
So just to, so if you're watching this, I think if no matter what you believe about vaccinations, trying to see people as rational and trying to understand them without in a sense condemning them or not listening to them, I think
Mm-hmm.
it's a huge issue, as we are kind of bifurcated in all these different groups, if that makes sense.
It is. It's really that's really true. And I think people need to understand that as healthcare providers, or at least from my perspective, from myself, it's not mine to judge you whether you get it or not. I'm going to take care of you the way I would take care of a vaccinated and an unvaccinated person are going to be taken care of the same way. Um, that's your decision, and I can't take that away from you, and that's one of the beauties of the country that we live in. But you're exactly right. There's we definitely have different mindsets of people, and I think we need to respect each other on that.
So, since we're going down this road, let's address the wearing of masks.
Mm-hmm.
That's another hot topic. And over the past year and a half, have a lot of conversations, and I'm sure you have too.
Mm-hmm.
I know the CDC has changed its guidance regarding masks as the virus has mutated. Can you kind of clear up any confusion people might have regarding masks, maybe talking to people who are vaccinated and people who are not vaccinated?
So, from my understanding, the latest information that was put out by the CDC, regarding mask wearing was the end of July. And on reading it, if you're vaccinated and you're outside, you don't have to wear a mask. If you're not vaccinated and you're outside in a free flowing area, you do not need to wear a mask. But the key is, vaccinated or not vaccinated, if you are in close proximity to people, you need to be wearing a mask, because you can still carry it and transmit it to other people. Um, Social distancing is still recommended, the 6 feet. So I mean, in close proximity, if you are going to a concert at the Tennessee Theater and you're sitting right next to somebody, by all means, wear your mask. If you're in the grocery store and there's like nobody there, that's a different story. You don't have to. It's, again, using your common sense, using good judgment, and carry a mask with you at all times, just so that if you get put in a situation where, oh, wow, I wasn't expecting this, you'll have it with you.
Yeah, that's a good point. Those are all great points. And the other thing for me, just in my role as a pastor, trying to pastor both um, different groups of people, just trying to recognize, and even different ethnicities, recognize, even though you may have your own personal freedom, or you do things, maybe you put on a mask uh, to honor that person, or for their own fear and anxiety too, as part of loving your neighbor.
Exactly.
So talking about loving your neighbor, there's a number of people who are watching this who are, people of faith. What can we as people of faith do to move forward in the days ahead?
So I thought on this a while, and there's still so many restrictions as far as who can come in the hospital, what you can bring in the hospital, and the power of prayer is just so needed right now. I think everybody and anybody, if they can just pray for us as a community, as a world, as individuals, to get through this together. We're not going to get through it unscathed, but we're going to get through this. And I think it's also important for people to understand that pray not only for the nurses and the doctors and the frontline workers, but there are so many people in healthcare that are connected with the whole process. You've got your dietary people who are working endless hours to provide good food, your pharmacy people, your IT people, social services. Then you go on the medical side of it, and you have your environmental services, who are hugely important to us because they're the ones who clean our rooms and turn our rooms over. They're
Right.
working endless hours. Registration, cardiopulmonary, lab, radiology. Everybody in our realm of medicine is so important, and we couldn't do it without our support staff. So I think it's just really important to give a shout out and to pray for not just frontline workers, but for everybody who's trying to take care of our sick patients, because we couldn't do it without everybody.
Yeah, that's a great point. I think that's really good. One of the things I'm seeing more is a kind of anxiety and frustration, and sometimes just kind of things seeping out in different ways. So uh, I guess my own thought would be if how to show grace to people during this time, because a lot of times, when you're hyped up and you're anxious, sometimes you're really not really grace filled. So it's best as be as grace filled as you can to offer that, especially to people different than you. I think that helps.
Mm-hmm. So important. And like I said before, most of our patients that come in have been kind and courteous and patient with us. and understanding, and they've been patients have been really, really terrific with us, and I'm thankful for the community that we're in, because without them we wouldn't be working. But on the same token, a happy patient makes our job a lot easier. So
That's true. What about if there's somebody who is watched to the end of this and say, hey, I want to do something to help kind of either frontline workers at the hospital, or what advice? I mean, you mentioned praying for them, into your normal prayer life. What is there, if somebody want to do something tangible, what would you recommend them do?
So the first thing I would say is probably send letters, cards. We had the grade schools making pictures for us, and the elementary school. Those are things that we can look at. They put them down the hallways and up on our bulletin boards. So that's a tangible thing that says, hey, we know you're working hard. We know you're trying to help us get through that. And like I said, right now, the hospitals are being very careful as far as what they're allowing in as far as food items. And there's all kinds of rules and regulations with, bringing in things to the hospital from the outside. So I would check with the hospital if you have something in mind. Call and check with the hospital, and pass your ideas through them. Cards, letters, things like that are always welcome. Anything more than that, you really need to pass it through the hospital first, is the best thing I can say.
Yeah, that's a good word. Yeah.
Yeah.
Well, thanks for being on the podcast today. I hope that those who've watched have or listened just better understand kind of what it's been like. And I know that's different in every hospital, every size, and every city. Is there any other kind of final words you want to give to everybody as we kind of close?
One of the things that my husband and I, for 30 some years, the thing that we've always said to each other when we have kind of a rough time going through something is, this too shall pass. So, if we all stick together, if we all work on this together, this too shall pass, and God will see us through it, and we'll be okay.
Yeah, that's a good point. Yeah.
Yeah, we'll be okay. Well, thank you for letting me share some of my tales and experiences.
Yeah, absolutely. Well, thanks for being on, and I hope this has helped a number of people better understand what it's like to live the life of a caring profession, for sure.
Well, thank you.
All right.
Thank you.
God bless you. Thanks.
Thanks. Bye.